No one is truly investigating when a patient suffers harm. Absolutely no one, said one current UnitedHealth nurse practitioner. The sense is, well, they're medically frail and no one lives forever. It's a special brand of evil. I mean, this is something, this is almost like the plot line, one of the plot lines of Better Call Saul a little bit. Although this is worse. This is more evil than that.
Hey, it's Jordan. I am in Flint, Michigan, East Palestine, Ohio, Tumwa, Iowa. Please support the only independent outlet on the ground covering what the corporate media covers up.
What's up, everybody? Ron Placone here, reporting for Status Coup. So UnitedHealth is in the news today. Now, keep in mind, there has been the Luigi Mangione thing, obviously, and also recently the UnitedHealthcare CEO, the new CEO, Andrew Whitty, who was making $26 million. He stepped down for, quote, personal reasons. And today on the internet, this was circulating. This is actually what I tweeted out. How sad. Maybe they could apply for a loan, but the low stock might be seen as a pre-existing condition. So look at this. They say, we are witnessing the downfall of the world's largest healthcare company. Look at that stock. Look at how far that is going down. So that's not doing so well. You might be wondering, is there more to this, though? What else is happening? Turns out there is a little more. And these guys are maybe the worst company on the freaking planet. We're going to go right to this headline. This is fairly breaking. This broke today. And this is from The Guardian. So check this out. Sorry. Let me close out of that. Revealed, UnitedHealth secretly paid nursing homes to reduce hospital transfers. This is as evil as it sounds. Here we go. A Guardian investigation finds the insurer quietly paid facilities that helped it gain Medicare enrollees and reduce hospitalizations. Whistleblowers allege harm to residents. So UnitedHealth Group, the nation's largest healthcare conglomerate, has secretly paid nursing homes thousands in bonuses to help slash hospital transfers for ailing residents, part of a series of cost-cutting tactics that has saved the company millions, but at times risks residents' health. Because, if you're elderly especially and you need hospital care, you should probably get it. Those secret bonuses have been paid out as part of a UnitedHealth program that stations the company's own medical teams in nursing homes and pushes them to cut care expenses for residents. In several cases identified by The Guardian, nursing home residents who needed immediate hospital care under the program failed to receive it after interventions from UnitedHealth staffers. Oh, get this. At least one lived with permanent brain damage following his delayed transfer, according to a confidential nursing home incident log. And there's recordings and photo evidence of this. So it sounds like perhaps this brain damage could have actually been prevented. This person needed hospital care. A UnitedHealth staffer stepped in and stopped them from getting that hospital care. Now they have brain damage. No one is truly investigating when a patient suffers harm. Absolutely no one, said one current UnitedHealth nurse practitioner who recently filed a congressional complaint about the nursing home program. These incidents are hidden, downplayed, and minimized. The sense is, well, they're medically frail and no one lives forever. The Guardian's investigation is based on thousands of confidential corporate and patient records obtained through sources, public record requests, and court files, interviews with more than 20 current and former UnitedHealth and nursing home employees, and 2 whistleblower declarations submitted to Congress this month through the nonprofit legal group Whistleblower Aid. This is a special brand of evil. I mean, this is something. This is almost like the plot line, one of the plot lines of Better Call Saul a little bit. Although this is worse. This is more evil than that. Not trying to spoil anything. Although if you haven't seen it yet, what are you waiting for? I do recommend Better Call Saul if you've not watched it. But this is actually similar to a plot line in that TV show, although this is more evil and this is real life. So they literally had their for-profit middlemen in the middle of elderly people getting care that they needed in hospitals to cut costs. And they had nursing homes that accepted kickbacks for this. So this is frightening on multiple levels, because we all have that stereotypical view of a nursing home, right? Like you have that stereotypical negative view of a nursing home where your loved one is being mistreated. And of course, not all assisted living facilities or nursing homes, whatever you want to call them, not all facilities are like that. Some are very, very wonderful places that really do take care of the people who live there. My grandmother spent the last several years of her life at one, and it was a very, very wonderful institution. She had excellent care there, and she lived to be 101. But not all of them are great. There's a reason that kind of Hollywood stereotype or stereotype of the TV show rather exists, because there is some truth to it. And now you see that these facilities were accepting these payouts, and UnitedHealth was doing this corruption. Reuters covered this as well. Let's go ahead. We're going to go over to the Reuters piece, see what they're saying about it. So check this out. UnitedHealth falls after report it secretly paid nursing homes to reduce hospital transfers. So shares fell more than 6% on Wednesday, that's today, after the UK Guardian newspaper reported that the company made secret payments to nursing homes to reduce hospital transfers, adding to the woes of the healthcare conglomerate. So that's the reason for the big fall this morning. It's not just that UnitedHealth is just a terrible place. There's the Luigi Mangione situation, and then there's also the newer CEO who walked away. Now, this is what really plummeted it today. So let's go ahead and go back a little bit here. So here is something that the Wall Street Journal was looking at a little while ago. This is from about a week ago. This is, I believe the date on this article is May 15th. Let me go ahead and get it on the tee for y'all. But this is from the Wall Street Journal, a very pro-business outlet. But here's what they were saying. UnitedHealthcare Group is under criminal investigation for possible Medicare fraud. I think we can eliminate that possible now. So this is from May 15th. So even back then, there were some, the DOJ was kind of looking into it. So let's see what's happening here. The DOJ is investigating UnitedHealth Group for possible criminal Medicare fraud related to its Medicare Advantage business. The investigation adds to other government inquiries into UnitedHealth, including potential antitrust violations. UnitedHealth faces pressure from investigations, a stock price decline, and a recent CEO change. So the Justice Department is investigating UnitedHealth Group. Well, I guess they're going to have a lot to work with now, aren't they? They should have an awful lot to work with. Or will they? Y'all, get a load of this. This is from UnitedHealth itself, and this is from today. So we got an update on that article from a week ago. Check it out. Statement regarding the May 21st article in The Guardian. The U.S. Department of Justice investigated these allegations, interviewed witnesses, and obtained thousands of documents and demonstrated the significant factual inaccuracies in the allegations. After reviewing all the evidence during its multi-year investigation, the Department of Justice declined to pursue the matter. So based on everything you just saw, the Department of Justice, what a shock, the Department of Justice, which is littered with a bunch of right-wing ghouls, decided there's nothing to see here when it comes to UnitedHealth. This is the same. These are the same institutions that are seeking the death penalty for Luigi Mangione. Such an act, seldom is the death penalty sought for such an act. And even if it is pursued, usually it takes at least a year of deliberating before they reach such a conclusion. With Luigi Mangione, they decided right away that it's going to be the death penalty. These same institutions are doing this investigation into UnitedHealth, and they're saying there's nothing to see here. And UnitedHealth is literally putting out a press release on behalf of the Department of Justice. That just shows you that we live in an oligarchy to the nth degree, a true plutocracy, where they just feel like they could just speak for the DOJ. Yeah, the DOJ found no wrongdoing. They said so. We're fine. Don't worry about it. The stock will bounce back. We don't care. Well, they are doing such an incredibly evil thing. Like how could somebody go through with that? Like how could somebody get dressed to go to work each day? Hey, what are you doing? What are you contributing to the world? I am stopping elderly people from getting care that they need in a hospital. Why? To save a company money so that the CEO can make more than $26 million next year. So now you might want to ask yourself, well, are they learning anything? Are they learning anything? Well, here's an address from today from the CEO. Ken Klippenstein shares this, or 48-second mark, excuse me, not minute. Be a very long address. All right, here. So check this out. Let me make sure it's on the T for you.
And there are very few people in the history of the U.S. healthcare industry who had a bigger positive effect on American healthcare than Brian.
That's the person who was shot. He's talking about Brian Thompson. He's calling him, no one has done more for American healthcare than that guy. The guy who denied people care, is responsible for countless amounts of deaths, to the point where somebody did this extreme act and terminated their life because of all the murder they were getting away with in the healthcare industry. He's saying that guy, one of the greatest.
We not only acknowledge and honor that legacy of Brian, but we will continue it. Our role is a critical role, and we make sure that care is safe, appropriate, and is delivered when people need it. And we guard against the pressures that exist for unsafe care or for unnecessary care to be delivered in a way which makes the whole system too complex and ultimately unsustainable.
Too complex. They just want to save you from unnecessary care. Unnecessary care like, hey, you're an elderly person and you need to go to the hospital or you might suffer brain damage. They want to prevent that unnecessary care for you. Just let you get the brain damage. Nobody lives forever. This is just evil. Even just the phrase health insurance industry should give everyone pause. It shouldn't be an industry. It's not that way in other countries. In other countries, it's a service. It's a system. It's a universal system that takes care of everybody. So you don't see people going into debt because of medical bankruptcies. You don't see scams like this happening where they're trying to increase profit while playing with people's lives. This is why we need universal health care. This is why we need Medicare for all. This system needs to end. And it cannot, the system, we cannot have these for-profit insurance companies cooperating. Like what they were saying, is there a way we can still get everyone covered and it's a good system, but the insurance companies still exist to make money? No. That's like saying, hey, I have a bunch of termites eating away at my house. Can we just get rid of some of the termites? Or would you hire an exterminator that says, hey, I just get rid of some of the termites, the rest I just tell to eat sparingly? I don't think you'd hire that exterminator, would you? So this system is broken beyond comprehension. And the fact that people can just go to work each day and do things like that, deny elderly people care that they need. And there's people, not even just with UnitedHealth, but apparently at some of these facilities, willing to accept the kickbacks and whatnot. I mean, that is just, it really does give you pause. It really does give you pause that nursing homes just accepted those secret payments, that UnitedHealth was willing to do something that evil, fly like an eagle. Yeah. Wow. That is something. So that is the breaking news on UnitedHealth. We'll see where this all ends. Right now, the stock is plummeting. And here's what you hope happens. So this is a tweet that this is a tweet from Matt Stoller. And I think this would be a nice solution. I feel like, I don't know how you get to this, but UnitedHealth Group should not exist as a corporation. Agreed. I actually think we need a bankruptcy style provision for corporations that exhibit a systemic pattern of recklessness with lives. Yeah, it would be wonderful if there was some kind of mechanism in place that when you do something like this, you are just shut down. If we had actual consumer protections and actual antitrust in this country, things like that would be in place, where if a company does something like this, they are just, forced out of operation immediately. And that's what should happen here. We'll see if it does. I mean, I doubt it. The DOJ is on UnitedHealth's side. The Trump administration is going to be on UnitedHealth's side. So it doesn't look good, but who knows? Maybe something wild will happen because public outcry will be so loud that it can't be ignored. That's the only thing we can hope for. Y'all, Thank you so much for tuning in today. Before we go, I will mention a couple things. So first of all, Seattle, I will be at you on Friday night. Are you in Seattle? Come out to the show Friday, ronplacone.com for tickets. That's May 23rd, Seattle, Washington. Can't wait to see you, Seattle. It's been a minute. And if you're low on funds but want to attend the show, email me. We'll get it situated. I know times are tough. If you don't really have the funds but you want to come to the show, email me. We will get it situated. Do not worry. Also, June, my new play Termination Fee, which is a scathing commentary on the American healthcare system. Very timely right about now. It's going to be playing throughout June as part of the Hollywood Fringe Festival in the Black Box Theater at the Broadwater. Our dates are June 8th, June 16th, June 21st, June 24th, June 29th. You can get tickets information at ronplacone.com. And of course, for everyone out there, please do watch my movie. My movie Left at Wall is out now. It's a fun indie comedy that calls out the Wall Street machine, and you can watch it now on Apple TV. You can watch it on YouTube Movies. You can watch it right here on YouTube. You can just rent it on YouTube. You can rent it on Google Play, Xbox, Amazon. You can buy it on DVD. It is out there. Left at Wall. For all information, go to ronplacone.com or just type in Left at Wall on your smart TV. And this is Ron Placone for Status Coup, signing out.